The burden of sickle cell disease continues to take a toll on families across the country, many of whom struggle to manage its demanding care. Once considered untreatable, the disease can now be effectively managed and even treated if detected early and interventions are started promptly. Brenda Wanga reports on 2 families living with sickle cell and how they are coping with the challenges and hopes that come with curing it.
For many families, a sickle cell anemia diagnosis spells doom. Lilian Odhiambo and her family know only too well what that pronouncement means. 2 years ago, this young boy, then aged 4 years, stared at the possibility of a life under this debilitating condition. Odhiambo's son suffered from a genetic blood disorder that brought with it agonizing pain and a lifetime of uncertainty. Sickle cell anemia is a condition where red blood cells, normally round and flexible, become stiff and crescent-shaped, blocking blood flow and depriving organs of oxygen. For families in Kenya and across the globe, it's a diagnosis that can turn lives upside down.
So the pain could always be too much. At times, the pain you take into hospital because of pain crisis. It's day and night he cries. Trying managing the pain with all sorts of painkillers at times could not do. So it reached a point. I said, can I? But the pain was also too much. I was also feeling as a mother. So like, when I try this, I'm going to lose him. Should I just allow him to continue with the pain? And then also, people could not understand him. I was like, when they go playing, the people play with him, the friends play with him as usual, but yet he is weak. So I was like, do I try? No. What if I lose him? He will say that it will be said that I'm the one who made him lose his life.
Lillian's experience led her on a desperate search for a cure.
First one was a pre-transplant treatment. This one involves chemotherapy and also radiotherapy. And then the procedure itself, the transplant, and then also post-transplant management. There are challenges because you know what chemo does to patients. By chemo, they're trying to reduce, to suppress the immunity, so that by the time the transplant is done, there is no much reaction, from the rejection that is from the donor, when I say graft versus host.
Her journey, like many with sickle cell, highlighted the limited treatment options available for severe cases.
And now he's been very, very active. Life has changed. I sleep, I dream. I can go somewhere. I can do my stuff, run my day-to-day life with no much worries because they're always okay. No crisis. He's never had any crisis since the transplant. No, the blood levels are always normal. It was done in 2023. Yeah. So since then, he's never had any crisis.
While Lillian's story is one of hope and success, a testament to the life-changing potential of bone marrow transplantation, that is not the case for many other sickle cell warriors. For them, the dream of a cure remains just that, a dream, often out of reach.
Nilichukua hata wembe nikajikata. Ukijikata, uchungu yenye nasikia kwa kujikata na wembe, kwa kugongwa na mawe, kwa kuchapwa, ni different sana na ile ya sickle cell. Ya sickle cell ni kama mtu ako ndani, ama ni kama mtu ni kama ako ndani yako na anajaribu kutoka nje. Ni kama mtu anagwara mfupa zako na fork. Yani ni kama mtu anadunga joints. Ni uchungu yenye huwezi bear.
Elvis has lived with sickle cell anemia for his entire life. He was diagnosed when he was barely out of his toddler years and has been managing his condition since.
Mwenye aliniambia iko matibabu yenye imetoka na inafanywa India. Na aliniambia ni stem cell yenye mtu anadungwa kwa red bone marrow. Na ukidungwa hiyo inakusaidia, hakuna uchungu yote unapata na sickle cell yote inaisha. Aliniambia hii matibabu ni milioni 10. Hivyo ndio venye aliniambia na inafanywa only on India. So nikashangaa sasa kama ni milioni 10 na kila mtu, kuna watu wenye wana hiyo pesa na hawawezi handle Sasa nikaona itakuwa ni kitu ni ngumu mimi kuifanya. So kama itakuwa ni kitu yenye mimi siwezi fikiri, basi niendelee tu kuishi venye niko.
Elvis's struggle is a stark reminder of the financial burden associated with advanced sickle cell treatment, a barrier that prevents countless individuals from accessing a potential cure. So, how does this transformative procedure actually work?
Patient comes, there are two forms of transplant. So there's what we call autologous bone marrow transplant and allogenic bone marrow transplant. So in autologous bone marrow transplant, this is for conditions such as cancers, lymphomas or leukemias, where a patient is transplanted with their own bone marrow cells after treatment with chemotherapy. While allogenic transplant is a patient is transplanted bone marrow stem cells from another donor who is usually a sibling after treatment with chemotherapy to the patient.
The success rates for bone marrow transplants in sickle cell disease are encouraging, particularly when performed at experienced centers. Lillian's son had this procedure done in India.
If you go for a transplant up to the age of 13 to 16 years, then there is a very, very high likelihood of getting a successful outcome. So 90% success rate can be expected if you do a timely transplant, particularly if it is done by the age of 13 years. And I often get asked that the donor is a sickle cell trait. Can they donate? So the answer to that is yes. Even sickle cell donors can donate to their siblings who are affected from sickle cell anemia.
Lillian's story is a beacon of hope, a powerful demonstration of how far medical science has come in treating sickle cell anemia. But Elvis's reality serves as a stark reminder of the ongoing challenges, the need for greater accessibility and affordability of these life-changing treatments. As medical advancements continue, the hope is that one day a cure for sickle cell anemia will be within reach for every individual battling this painful disease. Brenda, Wanga, Citizen TV.